The key point, though, is that immune therapy has improved progression-free survival and overall survival. So on this diagram from what is a landmark study called the Keynote-24 study, they looked at patients who got immune therapy, in this case, a drug called pembrolizumab or Keytruda, and compared it to chemotherapy. Now, on the y-axis is something called progression-free survival. This is not quite the same as overall survival, but what this really is saying is the amount of time that a patient receives treatment before something pops up on a scan, or what's called a progression event. And the thing to notice here is how high this tail of the curve is. Something like 40% of patients had no progression event. Or rather, sorry, I'm saying that incorrectly. 40% of patients had no progression event at 18 months. And that is much better than we ever saw with chemotherapy, suggesting that immune therapy is really a new type of treatment that is changing the landscape. And in fact, there are many, many studies that have demonstrated very similar findings, all summarized here for your reference. Now, immune therapy has side effects, and when we alter the reactiveness of the T cells, we can sometimes trigger them to be a little bit too aggressive to the own body. And so you can see a lot of these side effects developing with immune therapy treatments, or specifically immune checkpoint inhibitor treatments. These all mimic autoimmune diseases. And the ones in bold are the ones that are of severe consequence and need to be watched very, very carefully. What's really interesting about immune checkpoint inhibitors is that the timing of side effects is not immediately after treatment. So very often I'll get a call from the infusion center that a patient was treated with immune therapy, and then 2 days later, they're starting to develop symptoms. I can more or less guarantee that that is not an immune therapy side effect, especially if it was the patient's first dose. These treatments usually take at minimum 3 to 4 weeks to have side effects manifest, and they're shown in this very nice review article by Martins et al.